Hi, I'm Dr. Kavirani Nadarajan. I'm actually the director of Aryan Healthcare Centre Berhad, currently running Clinic Medi Royal, and I'm the resident doctor here. I was an alumni of MSU, I think in the year of 2008, graduated with Diploma in Medical Laboratory Technology. Currently, I'm running my own practice. It's a GP practice for past 1.5 years in Session 27 Shala Malamega, Clinic Medi Royal. So we are actually more on OHD services, which means Occupational Health Doctor Services. I'm actually specialized in wound care, so I treat more on wound care services in here. Once I graduated, completed my MBBS, I did my medical officer and also housemanship in Sabah for almost 6 years, Kinabalu for 6 years, and then I quit as a government servant and continued in another GP practice in a chain clinic for almost 5 years. So having an experience of being in a GP setting, in a general practice setting for almost 5 years, because I've been working for someone for very long and with a very was a lot of experiences and seeing patients almost like about 50 to 80 patients every day, that actually motivated me to why not I start on my own and why not I start serving on my own. I think most of the patients that I've been actually seeing for past years came in with diabetic wound and also more general any kind of wound. So that actually made me to seeing the wound progress and also looking at how well they heal. It gives a little kind of satisfaction to actually pursue in that field, that I want to treat more on wound and wound care and diabetic wounds, which will make me just like doing it. I just like to see the wound is healing perfectly and nice. That is something that made me to be more extra step into it and specialization. Diabetic wound, it actually varies. Some can be very mild, some can be treated in a GP setting in few weeks time, it can just heal, or some can actually take months to heal, and some will turn out to be a complicated cases that we have to refer to hospital for further management that we can't do in a GP setting. But I have actually saved a lot of saving these toes from amputation, do a minor surgery with debridement to heal the wound faster and all. So I do it here in a GP setting. So that helps a lot of patients, especially here who comes with diabetic wound and any wound at all, saving their toes and saving their feet. I do that. Once I completed my degree, I lost my dad when I was 15 years old, but I lost my dad because he met an accident. Then he was actually ridden for almost 8 months, and he was having this paralysis on the neck. He had injury on the neck, cervical neck, and then he was paralyzed he was bedridden and also hospitalized for almost 8 months. Then we lost it. That's when I think I wanted to do better in the medical. I think I could contribute something much better in sense of treating patients and also saving life. And then I'm doing it with full passion. And another thing is I like to study. I like to read. I want to gain knowledge about medical. So there's never end or stop in studies or getting knowledge. So that's why I keep doing certs. I keep studying. Coming up from a very poor family, so my dad always says, see, we don't have the money, but I think the education is the only wealth that will keep you going on. See, I'm married. I have a son who is 3 years old. The daily chores and activities itself, and wanting to be with him more and spending more time with him, actually, it's a very big challenge that I'm facing every day, because seeing my son growing, and of course every parent's dream is to be with the son and spend more time with the kids. That's a bit difficult because I run the clinic and I have to be at work until 9 o'clock. 9 o'clock is when I get back some time to spend with him, and I'm also working over the weekend. The only day that I'm free is on Sunday and to spend time with him. So I wish that I had extra time to balance. I'm trying my best to balance between my work life, my family, and my son, but I'm still trying. First of all, I would say a big thanks to MSU. Okay, why I would say that is from my SPM results was not very satisfying, and losing my dad at that age, with my dad results and also not financially very well-to-do with my single mother. The only thing is, I would say thanks to MSU because of giving me a chance to be in the program, the diploma in medical lab, because I wanted to be a doctor, but the only way to become a doctor from besides doing A levels or other foundation, it's diploma in medical lab. So MSU actually gave me a chance to join the program, and then with that, I was also given this PTPTN. I was also supported with PTPTN, so that actually helped me financially to complete the program. And the only requirement is I must get like more than a very good CGPA in order for me to continue degree in medicine. In that way, I'm very happy because MSU has actually given me the chance to do my diploma in that. I was active because I believe that knowledge is knowledge, your classes is classes, but curriculum and other activities are also important. So I joined the team as in the SED team I was one of the student representative council as the sports ESCO. So we do programs every every now and then, every few months. So since I was the sports ESCO, so I was doing everything related to sports. Yes, I was. So I also remember we did this Malaysia Book of Record, this non-stop baton relay. Yeah, for Merdeka for 48 hours. Yeah, I was part of that. So being here, actually this Clean Mediterranean, right, there's a reason why we actually chose this location, because the community itself, I wanted to give back to the community. I wanted to serve the community here. So they are B40 and above. I would say, like, based on all the patients' review and their feedback, we are the cheapest clinic in the town here. And we also have this Peka B40 free medical screening, and we also have we are also a clinic Madani based on the government program. We also we have the scheme Perubatan Madani, where they are those eligible, they can actually come and visit us for a free treatment and consultation as well. So it's time to give back. I think I have people have given me this level, so I think that it's time for me to give them back in return, and that's what I'm doing now. So even dressings and all that, since I'm doing it with passion, right, a very minimal charges of 30 to 50 ringgit only, which you can't get from outside. And even my consultation charges, if you believe it or not, it's just 15 ringgit. I'm talking about 10 to 15 ringgit only.
Traditional medicine or modern medicine?
Modern medicine.
Kuala Lumpur or Penang?
Kuala Lumpur.
Bollywood or Hollywood?
Bollywood.
Roti canai or dosa?
Roti canai.
Yoga or Pilates?
Pilates. Being an alumni myself and with a very vast range of experience, let me tell you little tips. I know being an MBBS student or doing medicine is really beautiful, and I know you're always with your books and all that, but just a little advice. Try to do more extracurricular activity. Get involved in social activity. That actually will improve your social skills, which will be very, very useful for your future when you develop yourself and become a doctor in the community itself.